Hi, my name is Sophia Shao, and I'm a third-year human biology major and research assistant working under Dr. Olivia Chang at the Department of Urology at UCI. Today, I'll be presenting about the development and evaluation of a vaginoplasty decision aid tool. So the reason why this decision aid is so important is because of this particular patient population. Trans feminine patients considering genital surgery face a very complex, preference-sensitive decision between three different procedures: penile inversion vaginoplasty, peritoneal pull-through vaginoplasty, and vulvoplasty. And each of these procedures result in distinct outcomes and require different surgical considerations. Despite evidence that decision aids overall reduce decisional conflict and improve the decision-making process, none exist for this current patient population. My goal here was to develop the first patient-accessible decision aid for this surgical decision. To do this, I followed a three-phase iterative development process. So first, I conducted a literature review and a surgeon consultation to build the initial draft. Then I conducted semi-structured interviews with 5 trans feminine patients to explore their decision-making process, informational needs, and design preferences. And I used this feedback to directly shape the final decision aid tool. And then lastly, I used quantitative evaluation through the user-friendly Patient Information Material Checklist, also known as UPIM check, and open-ended questions to test the comprehensibility and readability of the finalized decision aid. After I used this feedback to inform the final decision aid, which I will show in the next slide, we saw that over 80% of patients rated all 4 domains as meeting comprehensibility criteria, with structural and graphical readability scoring the highest at 100% and 93.7%. Qualitatively, all patients reported no decisional regret, as in they believe they would have maintained their original decision even if given the decision aid, but many indicated that the decision aid would have reduced stress, accelerated decision making, and increased confidence. I also wanted to show that this is the decision aid that I presented to patients for qualitative review, and I did use their direct feedback in the iterative development in phase 2 to produce information material that is clear, concise, and readable. Participants focused on the comparison chart and the diagram, which are emphasized here in the 3rd and 4th pages, as the most helpful components of the decision aid. This decision aid demonstrated strong preliminary feasibility in preliminary evaluation for preoperative counseling, and it fills a critical gap in standardized surgical decision support for trans feminine patients. In the future, research should prospectively evaluate this tool with patients actively facing this decision, which is why I mentioned preoperative counseling. Thank you for listening.